This conference will now be recorded.
So good morning, students. I'm audible to you. Please answer to me. Okay, thank you. So last time we finished the asphyxiants as well as the other toxic poisons. Okay. So today we are going to discuss about this systemic toxic uh, toxins or poisons, especially the toxins which are affect or act on the particular system, spinal nerves or cardiac system, whatever it may be, is a particular system. They may be useful. They are affecting the particular system, so you can read about this, especially depends upon the its action, and poison. We are going to discuss about the today. We are going to we finished this asphyxiants, which are acts on the respiratory system, and food poisoning also over, and botulism. And now in this next two classes, we will discuss about the spinal poisons and as well as the cardiovascular. So that's the poisons which acts on the cardiovascular system, isn't it? So, and at the same time, of peripheral nerve systems, the conium and the curia. These are also act on the spinal nerves, and uh, toxic poisons which act on the peripheral nerves. So now come to the especially that is the toxins which are acts on the spinal nerves, spinal cord, especially the nux vomica and the delirium. Come to these spinal poisons, strychnine. Strychnine is the poison which acts on the, especially on the spinal cord. It is the highly toxic, colorless, and bitter crystalline alkaloid. See, strychnine is the source is the seeds of the plant Strychnine nux vomica. So the ripe fruits contain the poisonous seeds. In generally, all the parts of the plant are toxic. This is Strychnine nux vomica. The plant is all the parts are toxic, depends upon this. And apart from this, the strychnine and brucin are the active principal alkaloids in the seeds, especially. But the leaves, roots, and other parts also contain the toxic principles, especially brucin. But strychnine is the poison which is especially from the extracted from the seeds, the crushed seeds, strychnine. And brucin and logrin and another two alkaloids are there. That means active principles are there. They will extract from the not only from the seeds, and it will be extract from the roots and other parts of the leaves and other parts of the plant also. Strychnine, especially, it is extracted from the seeds only. So it is more toxic than the brucin. Strychnine. It is used as a pesticide, particularly in the killing the birds and the rodents and stray dogs. And then the municipality will choose it. The stray dogs will be killed by this toxin, strychnine. They will give to the dogs. They will be paralyze the dogs, and they will kill the birds and rodents and the stray dogs. So the small dose of the strychnine acts as a respiratory stimulant. That's why it's a respiratory stimulant. It will be used in the medical field. Now see this. This is the strychnine plant and the seeds, fruits of the strychnine, and you can remove. You can open the fruit. It is orange red color, orange red in the color. And if you open the fruit, you can observe this the seeds of the strychnine nux vomica. It is round and one side concave, one side is convex. The seed is very toxic and it's a poisonous one. And these are the seeds that is extracted from the strychnine nux vomica fruit. It's very toxic and it consists of strychnine and brucin also. Now, what is the pharmacokinetics of this strychnine, that is especially the spinal poisoning? The poisoning can be orally or by the injection. So the crushed seeds are toxic basically. If you are the person who ingested the seed directly into the directly by the orally, if you take, it is not poisonous, and that means it will not affect the person. Only the crushed seeds or the extract from this is injected or taken orally, it is poisonous. So it is rapidly absorbed from the GIT tract and mainly metabolized to the liver and microsomal enzymes and excretion by the kidneys. In severe poisoning cases, maximum concentration is found in the liver, blood, kidney, and stomach parts. Isn't it? So whenever the person taken orally or by injecting, it will be active. So directly the seed will not be cause any toxic effects. See, the basic mechanism of this strychnine exfoliant uh, is so come to the glycine. Glycine is the normal mechanism of the normal mechanism of the neuron system, that neurotransmitter. Glycine is the inhibitory neurotransmitter, isn't it? It acts on the ventral motor neurons present in the spinal cord and brainstem. It produces the inhibitory postsynaptic potential and control generation of the action potential. By that, it controls the muscle contraction and the muscle not so excited. So the glycine action basically it controls the muscle contractions, over excitement often. So control the muscle contraction and muscles not so excited. That is the basic mechanism of the glycine. So it is inhibitory neurotransmitter, isn't it? It acts on the ventral motor neurons present in the spinal cord and brainstem and produces the IBS, inhibitory postsynaptic potential. So whenever the person who is taking this strychnine, poison, it inhibits the glycine. So it encourages the excitability. So it blocks the glycine. By that, it will causes the contractions of the muscles. See, the strychnine blocks the glycine, acts on the motor neurons present in the spinal cord, abolishes the inhibitory potential. So it increases the generation of the action potential and increase the muscle contraction, increase the muscle excitability and conversions. So that is the basic mechanism of the strychnine. It blocks the glycine. Glycine is the inhibitory neurotransmitter. So it blocks the glycine, so that it leads to the muscle contraction, increases the muscle contraction and increase the muscle excitability. Remember, basic mechanism of the glycine is the inhibitory neurotransmitter. So by that, through the glycine, the muscles will be controlled contractions. Muscles not. So strychnine is what happens, it will be block the glycine. By that, it increases the muscle contraction, increase the muscle excitability and the convulsions, isn't it? So you have to remember these two mechanisms. And what are the signs and symptoms whenever taken by the injection or injection or whatever it IV or orally? The fatal dose of this is 50 to 100 grams, and the fatal dose is 50 to 100 grams, and he may be died within the 2 hours. 1 to 2 hours is the fatal period, and it's when taken orally, it causes a bitter taste, severe nausea, and vomiting. And convulsions are the most specific symptom. That's why this it blocks the glycine, so it leads to the excitability, increases the excitability and the contractions. So it may be convulsions may be occur. Most specific symptom in this strychnine exvomica. All the muscle reflexes are exaggerated, and at the same time, you have to remember in this all the muscles will be affected. So throughout the body it will be affected, and at a time all the muscle reflexes are exaggerated. Spasm of the facial muscles causes sinuses, dilatation of the pupil, and froth present at the mouth. Especially, it is shows the blood tinged froth. Blood tinged froth. So, rhizus sardonicus may be present. That means rhizus sardonicus is the contraction of the facial lower jaw muscles and may lead to the contractions at the lower jaw. That is one of the rhizus sardonicus present. In this case, strychnine poisoning, and the consciousness is not lost and mind remains clear till the death. That's why the specific type of the convulsion, conscious convulsions, conscious convulsions are seen in this strychnine poisoning. You have to remember, and death due to the asphyxia as well as thoracic muscles and diaphragm are affected. So already I told that means it will affect the muscles of the total body. So it may lead to the thoracic muscles. Also affect the thoracic muscles and diaphragm, which are useful in the respiration. So it blocks the finally lead to the respiratory failure, isn't it? So that is the signs and symptoms and death due to the asphyxia. Okay. So what are the convulsions of the occurred in this strychnine poisons? See, the strychnine poisoning convulsions of all the muscle groups at the same time and most marked in the anti-gravity muscle situation. So you remember we are going to next differential diagnosis of this strychnine poisoning will be with the tetanus. Tetanus, which is caused by the Clostridium tetani. So equal గా ఉంటుంది. But what are the differences between these? అన్నప్పుడు we will go the differences between the tetanic convulsions. So here the convulsions of all muscle groups at the same time most marked in the anti-gravity methods. Remember that. Next, what are the characteristic features of these convulsions? It is preceded by the prodromal symptoms like twitching, increased rigidity of the muscles. First clonic and later tonic type of the convulsion will be occurs. The duration of the convulsion is variable. In between convulsions, muscles are relaxed and the victim looks exhausted, isn't it? Later, slight provocation similar to the convulsion. So the person gets convulsions and 1 to 2 minutes or whatever it may be, the duration it will be stable, and after that, in between, it will be stable, and immediately the person will be calm. At that time, the provocation, that means if you stimulate the person or any noise whatever touch whatever it may be, it will be stimulate the again the conversion. So conversion will be continued like this. The body assumes falling position in the because of these contractions of the muscles, because of this strychnine poisoning shows the opisthotonus, emprosthotonus, and the pleurosthotonus, the three conditions where the person attain the position. Opisthotonus. So already we discussed the rhizus ordonicus will be occurred in the contraction due to the muscles of the lower jaw, and opisthotonus hyperextension. In supine position, the body is supported by the heels and ox. That means the head will be that will say go back and the heels. So these the body like a bowl out, an arch lager in this condition. Because of this opisthotonus. Why? Because it leads the paravertebral muscles will be contracted. By that opisthotonus will be occur. Isn't it? Body will be in a bow-like position or arch-like. Emprosthotonus is the spasm of abdominal muscles pull the body forward. So this is known as the emprosthotonus. And a pleurosthotonus, this the body is flexed to one side. So these are the three conditions: opisthotonus, emprosthotonus, and pleurosthotonus. These will be occurred due to the strychnine poisoning and due to the muscle contractions, especially opisthotonus, and the paravertebral muscles will be contracted. That is because of this hyperextension of the body. The person will be based on the heel and the occiput. That means head mounted, isn't it? Like a bow. See, this is the opisthotonus where the paravertebral muscles will be contracted. The person will be lying on the heel and the head, isn't it? This is the opisthotonus. See the forward because of the abdominal muscles contracted forwardness, and this is the what do you call this? The pleurosthotonus. The body is flexed to the one side, isn't it? These are the effects due to the contraction of the body muscles. And talk of the strychnine poisoning. You can remember the signs and symptoms of the, remember like a simple mnemonic. You have to remember, don't write in the examination like a cramp. Cramp and you have to remember for the remember sense a mnemonic like cramp. So first of all, the basic symptom are very important symptoms in these convulsions. Okay, clonic type, and reflexes are increased. All the reflexes will be increased, and a awful taste. And the mind is conscious till the death. A person will be conscious, and at the semi-conscious convulsions and condition. The pupils are dilated cramps. These are the main symptoms you have to remember, like a cramp, a mnemonic of the strychnine poisoning. Now, what is the physiological test to detect the strychnine poisoning? the person who is died because of the strychnine poison, you can identify this. The suspected material is taken from the body as a liquid gun, bleed gun. You can take this suspected material injected into the aqueous form to lymph sac of the frog. You can inject into the frog lymph sac of the infant. If positive means, then there will be a tetanic conversion in the few minutes of the frog. In case of the frog, it will show the tetanic conversions of the frog. So if you exaggerate or if you touch or if you beat it again, it will be start the conversion will be occurred. So again, assess or to test the strychnine poisoning again. Now, what is the treatment or management of the conversions? So, in case of the if you completely you fix that the person is affected with the strychnine poisoning, immediately you can keep the person in a dark room and away from the noise and the disturbances, isn't it? Or otherwise, the disturbance are from the noise, it will be exaggerate the convulsions of the person, isn't it? The condition will be worse. So first of all, you have to take the person and keep in the person in a dark room and away from the noise and the disturbance. And come to the to control the conversions. First of all, you can the diazepam and the phenobarbital, short-acting barbiturates. It is phenobarbital sodium, sodium amytal. You can give diazepam and the phenobarbital, sodium amytal also you can give the diazepam and IV, and general anesthesia and muscle relaxants you can give for the treatment of this strychnine poisoning and sodium amytal IV. These are the basic the drugs you can give to the person to control the convulsions, especially in this strychnine poisoning. And go for the gastric lavage, the potassium permanganate, and symptom otherwise symptomatic treatment you can give for this. It is the strychnine poisoning and signs and symptoms and the treatment and the management. Now come to the what are the autopsy findings in this case. So whenever the person died because of the strychnine poisoning, they brought to the laboratory, and from that they brought to the mortuary. The strychnine may be detected in dead bodies after 4 years. Up to 40 years, 4 years, it will be removed. The putrefaction will be delayed actually because of the strychnine, and the strychnine poison will be stayed up to the 4 years in the body. So at any time you can take the sample and detect this due to the strychnine poison. So no any of any specific findings on a particular game. The rigor appear early but not prolonged. The signs of asphyxia will be present, cyanosis and other asphyxial signs will be present. Congestion, all the internal organs will be congested, and the patchy congestion of the stomach and duodenal mucosa you can observe. Congestion of the liver, kidney, brain, and spinal cord you can observe. Apart from the routine viscera, that generally we will send the viscera for the chemical analysis in case of the poisonings. In any poisoning, food poisoning also, and other poison, toxic poisons also, or snake bite also, whatever it may be, we will send it for the chemical analysis. So generally we will send the stomach and its contents, and liver, kidney, and half of the liver, and whatever it may be, we will send the parts of the body for the viscera for the chemical analysis. Apart from this, it is spinal poisoning. That's why you can remove the spinal cord also and preserve for it chemical analysis. So this is the autopsy findings in this case of the strychnine poisoning. And come to the medical legal significance of this. So sometimes it is possible that is homicide, and suicide is very rare because of the very big condition. And homicide is possible, and accident deaths may be common. It is used as a cattle poisons, animal poisons, and arrow poisons. We will be used to kill the cattle and the animal poison and the arrow poisons. So the medically significance of this poison, most probably homicide of వాడుతుంటారు, and now that's why the animal poisons, stray dogs and birds, and they will kill the birds also. So they will use it as a arrow poison. This is the toxic. So come to the poisons. Strychnine poison. Already we discussed that the conversion will be occurred and other symptoms will present like a natural disease. Strychnine poisoning, the signs and symptoms will be like the natural disease is tetanus. The tetanus is caused due to the Clostridium tetani, microorganism. It causes a Clostridium tetani. So there is a natural disease which resembles like a strychnine poison. So you have to differentiate the strychnine poisoning from the this Clostridium tetani. So here see the history of the strychnine poisoning. No history of the injury is there. But in case of the tetanus, what happens? The history of injury present. Whenever the person met an accident or injury, any injury present over the body, it may be contaminated with the dust. So in the dust, there is chance of the Clostridium is there. The organism will be infect the person and it may causes the tetanus. Say injury present, wound tetanus, wound. So there is a history of the injury present in case of the Clostridium tetani, and onset is sudden in case of the strychnine poisoning immediately, and in case of the it is an infection, that's why it will be appear in the gradual. That is the Clostridium tetani, and the convulsions affects all the muscles at a time. In strychnine poisoning, within immediately within a short period, the body all the muscles will be affected at a time. Already we discussed. But in case of the tetanus, what happens? There is a difference. It will be started with the small muscles like this. Gradually, it will be affect the muscles. See here, all the muscles will be at a time. That's why 1 to 2 hours don't bother much in case of the sticking point. So total muscles will be affected. The lower jaw not so. That means every muscles will be affected in this time. In particular, lower jaw name under. But in case of the tetanus, it starts in the lower jaw and especially affected tetanus. And next comes the muscular conditions. In between the fits, it is relaxed. So there is a total completely relaxed hypothetical. In cyclic poison, whatever the conversions will be occur, it will be stopped and complete in between the person will be relaxed. But he is exhausted around, but relaxed. But in case of the tetanus, in between the fits, it is a slightly residual muscle spasm. So the fatal period will be 1 to 2 hours in case of the strychnine poison. It will take that more than 24 hours in case of it is an infection. So chemical analysis, if you send the viscera or anything, it is positive for the strychnine poisoning and no poisoning in case of the tetanus tox. Suppose if you do the culture of the same specimens, if it is suffered because of this tetanus, there is a chance of the Clostridium will be detected in the culture. There is a difference between this strychnine poisoning and the tetanus. Isn't like arsenic poisoning, natural disease differences to swallow. You have to see the differences between the strychnine poisoning and the tetanus. So come to the already which is this is the spinal the poison which affect the spinal cord, and one more two poisons are there, peripheral nerve poisons. So these are the curare. Simple only how to remember first. The peripheral nerve poison is the curare and action is reversibly blocks the acetylcholine receptors at the neuromuscular junction, causing flaccid paralysis of the skeletal muscles. So acetylcholine receptors blocks the used for the muscular relaxation in anesthesia and as a arrow poison and death mostly due to the respiratory failure. So it affects the respiratory muscles also. That's why it will lead to the Yes. And what are signs and symptoms of curare poisoning? So no effect on the ingestion, but effective only on the parenterally if you give. So whenever over a dose in case of the when you are going to anesthesia, giving the anesthesia, it may be occurs the accidental death in case of the curare anesthesia. So the signs and symptoms no effect on the ingestion, effective orally parenterally when you give an injection over. Paralysis of the limb muscles and respiratory muscle will be occur in large doses may lead to the conversions. So treatment is IV neostigmine and physostigmine and artificial respiration. The accidental deaths ఉంటాయి anesthesia ఇచ్చినప్పుడు overdose అవుతుందని isn't it? This is the curare poison and one more thing that is the peripheral nerve poison that is the conium maculatum. So Hamlet is the famous why because of the Socrates, the philosopher. Greek philosophy is executed by this because it is a scientist, philosopher. He says something number of people, they are not accepting the Socrates, but whatever the findings or whatever the Socrates told to the people, they are not accepting that, and that's why he is executed by this Hamlock. Not you remember this Hamlock. And what are the signs and symptoms in this? Is the by inhalation, it will lead to the, that means the fresh leaves, unpleasant mousy odor, and the dried leaves will be narcotic. Ingestion, it may lead to the burning sensation in the mouth and the throat, gastric inflammation, the diarrhea, mental confusion, attention, progressive motor paralysis, and death from the respiratory failure. This is the Hamlock. S and you have to remove that, name you can remove the spelling mistake. So this is the Conium maculatum, the plant from which the Hamlock will be extracted. So remember the Hamlock and Conium maculatum, it is from the, and next cure is the, these two are peripheral nerve poisons which are discussed in this, and spinal poisoning, that is strychnine nuts vomica. How to remember the strychnine nuts vomica is a very important thing. It may be, they will give in the examination also. Is the peripheral nerve poison. It's important because the execution of the Socrates with that poison, that's why it is popular. So remember in entrance question, Hamlock entrance question, extracted the maculum and cure. These are the spinal and peripheral nerve poisons. This spinal and peripheral nerve poisons are over. In the next class, we will go for the, this is cardiotoxic poisons. Remember the what are the cardiotoxic poison, especially Nereum oleander, Cerebra thavacia, Cerebra odalum, aconite, and nicotine tobacco. These are the 5 are the cardiotoxic poisons which affect the cardiovascular system, isn't it? So with this, spinal poisons, peripheral neural poisons are over. This cardiotoxic poison will be discussed in the next class. Tomorrow we will discuss about this cardiotoxic poisons. Okay, thank you all of you. You can leave.